I think for so many of us, when our aging parents run into a certain problem, I guess you could say, then they need some help. And it's more than just independent living or even assisted living.
Mhm.
And that's when skilled nursing really comes into play.
And it can be confusing to know all the different types of
Yes.
care. So we brought in Jamie Smithson. She has been in the healthcare industry and the senior care specifically for more than 10 years in the Austin area. So thank you so much for being with us, because I think there is a lot of confusion when it comes to skilled nursing.
Absolutely. And if you don't live it and go through it, it's hard to really know what you're looking at and what you're facing.
Yeah.
So we're going to start with the basics. Let's talk about first of where might your aging parent be introduced or need skilled nursing?
So skilled nursings do two types of care. They do short-term rehab. So if your parent fell or had an infection of some type, ended up in the hospital, typically it's a 3 midnight stay that would activate the skilled nursing benefit. And then a physician would make a referral saying that they need to go to skilled nursing for short-term rehab. The average length of stay in a skilled nursing for short-term rehab is about 3 weeks. But with traditional Medicare benefits, you have up to 100 days of therapy available. Most people do not use that 100 days unless they've had a severe stroke or a really, really traumatic event. So that's the short-term rehab element. There's also the long-term care. That is something that sometimes after someone goes to rehab and isn't able to get to the point where they're able to care for themselves and they really need that nursing 24/7 and, CNAs and nurse practitioners there to see them. So again, the long-term care can either be from people who don't make it out of rehab or people or your family is concerned and they're thinking that they need to, be in a place that's not at home and get more care.
I think that's one of the confusions again, is because there's so many different types of care. If someone says, yeah, mom's not doing very well, I think we need skilled nursing to come into the home and take care of her. That's not really skilled nursing, correct?
Correct. So you can have a skilled need, which can trigger home health benefits, but a skilled nursing facility, or SNF or SNF, is an actual facility where you go and you stay, again, either for short-term rehab or for long-term care. They're set up like a wagon wheel, and there's a big nurse's station in the middle, and then there are hallways that feed off of it, like spokes on a wagon wheel. Okay. So typically someone is going to, the facilities will have their long-term care hallways or their short-term rehab hallways, and what you're there for will dictate where you're going to stay there.
And how do you choose a skilled nursing facility?
So what you really want to do, if it's for short-term rehab, location is key. You want to pick one that's close so that you can really advocate for your loved one and be able to see them and keep track of their progress. If your loved one had a stroke and let's say has swallowing issues, when you tour, you can ask them to be able to speak to their speech therapist while you're there. So you want to pick based on location, and then also what is the primary rehab need that your loved one has. If it's a nursing need like wound care, I would ask, and again, make a tour, ask to be able to speak to the DON or the DON or the wound care nurse that will be able to kind of give you a feel for what the care is like and what you're looking at. And you want to be able to have a connection with them, because for that short period of time, they are going to be integral in your life and your loved ones. So proximity, and then it will be the primary type of care that your loved one is needing. Like what discipline at the facility will they be using the most?
Mm-hmm. I think for so many of us, we have dollar signs in our eyes as we're thinking about, oh my gosh, what's this going to cost? When I think about my dad who lives in independent living, my mom who lives in memory care, if anything happens to either one of them where they have to go to skilled nursing, does it just compound the cost, because they're still going to have to pay for the room that they have, because hopefully they would go back there. So how do we afford that?
So for short-term rehab, that is going to be covered by insurance, primarily Medicare. And again, that's that 100 days that we talked about. Mm-hmm. Skilled nursing facilities do take the Medicare replacement plans and traditional insurance plans as well for those who are still working. Okay. For the long-term care portion, primarily Medicaid is the funding for that, and that is for people that meet financially, they qualify. Yeah. And then there also has to be a physical qualification, and that typically is a cognitive impairment. Back when I worked in skilled nursings, we get people that would call and say, well, mom has community Medicaid, which is, you can qualify for that at home for meal delivery and a variety of other benefits. It's much harder to qualify for Medicaid in a skilled nursing setting because it's so much more expensive. So primarily government funding is what pays for skilled nursing facilities. It is the second heaviest regulated industry that there is because their primary source is government funding. In the assisted living setting, for example, their regulation book is a fraction of the size, but because they're taking private pay.
Got it.
So because of that stringent regulation, they can't vary too much. They all very much have to do the same things and check the same boxes, which is why picking one that is in close proximity to you so that you can be there to advocate for your loved one really is the best way to go about it. Because again, they're all kind of fundamentally going to do the same thing. It's going to be your management team that's really going to kind of make or break your experience there.
And what's the best way to actually find them? Will the hospital give recommendations? Do you find a senior care advisor? What's sort of the best way to find the place, the skilled nursing facilities? So
that is the part that does get wild with people in the hospital. I think that when I used to work again in that setting and I did admissions, you have mom or dad falls, they go into surgery, they come out, and within the next day, the hospital is in there being like, well, we're going to talk about discharge. And no one ever feels prepared for that. You're given a list. Some of the hospitals have shortened up that list to their preferred providers, and the social workers and the discharge planners will be the ones that come in and talk to you about that. What I have found is that these social workers will say, oh, yeah, option A, I've been there. It's great. I've never been there. I would bet anything on it. They are just trying to get people out of the hospital because everyone's on a time crunch, right? They need that bed for the next person. So you will be given a list, but again, pick one that's close to you because there might be a perfectly good one around the corner that didn't make that list. I'm going to say there's probably, it's hard to even speculate, but 40 to 60 skilled nursings in our area. They're
in the Austin area. Okay.
Yeah, there are quite a bit of them.
Is it like that everywhere? Or just around the country? Is it just more and more skilled nursing areas?
Yes, there are new ones being built pretty frequently, as well as assisted living, senior livings. We got that silver tsunami that is upon us, so there's simply not enough places or enough people to care for everyone. But in the denser populated areas, in the bigger cities, yes, there are going to be a plethora of them to choose from. So again, that social worker will come in, hand you a list, look at 3. Don't go look at 5. That is analysis paralysis. And again, what you're looking at has the same regulatory body and guidelines at every single one. So look at, I would say no more than 3. And again, call ahead. Tell them what's going on with your loved one. Speak to that admissions person and say, whenever I'm there, can I talk to your speech therapist? Can I speak to your nurse real quick just to get a feel for them? And that is going to be the best way that you're going to be able to make a decision. And it's such a hard decision to make. You have to, you're going to make a decision with the best information that you have at the time, and you're going to work through it from there.
Yeah. I was going to ask if there's any certain questions that we should ask, because that's one of my favorite things about when we were picking the memory care place for my mom. We had no idea what questions to ask, what red flags to look for, anything like that. We went off the fact that one of them hugged us. So they were very nice, which was good. And we picked a great place. But when you're in crisis mode here, if you're talking about skilled nursing, so something bad has happened, your mind's going a million different directions, and now you're trying to find the best place for mom or dad
in a short amount of time.
Yeah. So is there a certain question or questions that you should really be thinking about? Like, do you have this, or should I be looking out for that, or anything like that, just to help the whole process?
Feel is very important. You shouldn't dismiss that for a second, that was what sway you, for your loved one. Again, they're all super regulated. They all do very much the same thing. So go and tour. Some facilities are going to have more nurse practitioner coverage than others. In a skilled nursing, it is considered the lowest level of care because of the physician oversight. You're going to have a medical director in each building, but they're only going to be there maybe 1 or 2 days a week is pretty standard. So typically there's going to be a nurse practitioner that will be there about 5 days a week. Hopefully that's really great coverage. Also, it's if they have 24-hour RN coverage, All skilled nursings have to have LVN coverage, but they are not required to have the RN coverage.
Okay.
Another thing that you can look at is the Medicare.gov website. Skilled nursing facilities go through annual surveys that can sometimes last, up to a week, depending on what the survey team finds. And it's the surveyors with the state of Texas that go in and go through a fine-tooth comb. That is all reported on that website, and it's a star system. So you can have between 0 and 5 stars. I'm going to say that that's a good system, but it's not a great system because the things that you can get dinged for are really kind of subject to that surveyor and what they're choosing to fixate on. But all that is available online. And again, Medicare.gov. So go with feel, go with the star system, and go with the professionals that you were able to speak with while you were there.
Yeah. And then once your parent gets there, what are the best ways that you can work with the staff to really hopefully get the best outcome for your aging parent as possible?
So again, whenever I worked in buildings, they're going to do therapy 5 days a week. Very rarely do facilities have therapy on the weekends. One of the things that we would say is that, I got a call from mom and she said she's not doing any therapy. Well, that's the number one way that facilities generate revenue is from people doing therapy and billing for that. So the facilities have a vested interest in getting your mom up every day and getting her down to, therapies so that, again, they can bill for that. Any nuances that make your mom tick, like mom is not a morning person and that has only increased the older that she's got, put together an email of the things that make your mom tick. Send it to the administrator and the director of nursing and the social worker. Emails are a great way to communicate within facilities because it's time-stamped. Never put just one person on it. Multiple eyes on it is a better way to solve your problems in a timely fashion. So communication is key. If they don't know, how can they fix something that's wrong? And sometimes, the older generation, they're kind of stoic and they're not going to complain to us because we're strangers, but they will complain, endlessly to their kids. We got to know that. We got to know no matter how small it is, what the issue is, because otherwise we can't fix it and it's just going to keep happening.
Wow.
What was funny is I was speaking to a colleague of mine earlier, and she talked about laundry. She worked in skilled nursing for 20 plus years. It was the number one thing that she got fussed at about by families. So she said, tell them easy to pull on sweats and things that aren't of a tremendous amount of value. Make sure you mark and label those things before they come. In skilled nursing, laundry is done in big bulks. Like everyone's laundry is thrown in together. It's really easy to lose things. And bring about 4 days worth of things.
Okay.
Don't bring your whole wardrobe because don't bring anything that you don't want to lose. Don't bring anything of value. And if mom really likes fancy, expensive toiletries, bring it in small amounts. So when it's things like that sound insignificant, but they are things that are probably the number one complaint of families in skilled nursing. And then us, we're taking care of 100 plus people with acute issues. Sometimes laundry isn't going to be, if we're going to fail at one thing, we may be okay with failing at laundry.
One last question, and I hate to be negative about this, but if mom was supposed to be in there, the doctor said mom needs to go to skilled nursing for 3 weeks. It's been 2 weeks and you don't see any improvement. It doesn't seem like anything's gotten better. Is there a backup plan, but is there something we should do just to make sure that she's getting the correct care, that we put her in the right place? Any type of plan that we should follow up on there?
You'll have care plan meetings when you're at the skilled nursing facilities, which is where the team will meet with you. You'll have someone from every discipline will be able to discuss her progress, and you would be able to express those concerns, like she's not making any progress, right? So you'll have those pretty regularly, depending on how long that you're there at the facility, but never hesitate to reach out to the nurse practitioner or the director of nursing and express your concerns. But there also has to be a level of being realistic. Whenever someone is in their late 80s, early 90s, sometimes people just don't bounce back. It may take longer, and sometimes they just might not bounce back from things.
And the percentage of people who go to skilled nursing and go home or go back to their independent living or back to their lives is very high, right?
Yes. And there's, again, I did admissions and hospital assessment. So I'd go to the hospital and see these people with these, the elderly, those bruises sometimes, oh man, they look really rough. But to be able to see them 3 weeks or a month later, whenever they go home and they're back to their baseline, there's nothing honestly that skilled nursing facilities love more than to see these success stories and be able to celebrate that with their whole team and these families. So yes, that is the number one moneymaker. Also for those skilled nursing facilities, you have to keep that in mind. All these places are businesses, that is how they build a good reputation with the case managers at the hospital and in the community, that they got someone in who had this traumatic event, and then look how great they look whenever we send them home.
Yeah. Right. So the goal is always to have that traumatic event and basically get them well, if you will, or rehabbed so that they can go back to the lives that they were living right before.
Yeah. Absolutely. That's the number one goal when someone comes in for rehab. And, again, you're going to be working with a team that wants to get them there. And, but again, every person that we care for in those buildings, and sometimes it's 100 plus, is the most important person at that, or that most important person to someone else. So it's a lot of pressure that we're under, and we have our patient dynamics as well with the family dynamics, as well as us as human beings with our own dynamics. So it's a lot that goes on there. And those employees there are just the salt of the earth people. And again, there's usually a logical explanation for something. If you show up and something's not to your liking, or mom says something happened, investigate before you react, because we want to do a good job with everyone, but you don't want to be that person that whenever they get that email, they look at it and go, so investigate before you react, because again, there's usually a logical explanation for why everything happened or why a staff member made a decision that they did, and give the team time to investigate and come back with you with an answer.
Yeah. Okay. Great. Definitely a confusing subject, but you've sorted through a lot of answers. Thank you so much, Jamie.
So happy to help.
Yeah, there is just a lot to know and to be aware of. And I think the thing I heard most is get a plan, speak up, and get to know the people that are going to be in that skilled nursing working with your parents.
And have patience, because sometimes it'll take a while. If you have any type of topic you'd like us to discuss, let us know. Parenting Aging Parents.